Hey friends, I'm Diane from Early to Bed, Early to Rise, and I am so glad that you're here today. So I'm an integrative medicine physician assistant. Today I want to talk to you about one of my favorite topics, adrenal fatigue. Actually, it's more accurate to say HPA Axis dysfunction, and we'll get all into that in just a minute. So I have seen so many people with adrenal fatigue symptoms, HPA Axis dysfunction, and it really has become almost an epidemic in our society these days, the way that people operate and how their poor little adrenal glands and HPA axis are having trouble keeping up. And personally, I have walked through this twice and healed it up. So I can speak from a voice of both professional and personal experience that when you work on this and it gets better, your life is gonna change. You are gonna feel great. So take that little bit of encouragement, and also a little plug for your body and how awesome it is and how well we've been put together. Your body wants to heal this. Your HPA axis is trying to get itself back online all the time. So when you implement small steps towards getting better, you will notice big changes. So yay! As awful as you might feel now, know that there's hope and know that you're going to get to feeling better. Okay, so the HPA axis is so important because it regulates your stress response, your sleep-wake cycles, your energy levels, your metabolism. It has a huge role in your immune system, so how often you get sick, how quickly you get better, so many different things. It also can directly affect your digestion as well as your reproductive hormones. So lots of important things here going on with this talk today. So your adrenal glands sit on top of your kidneys. They're two smallish little glands. They make a ton of different hormones that are really important. They make mineralocorticoids, which help to regulate your electrolyte levels and set blood pressure. They make glucocorticoids, cortisol being the most notable of those. Cortisol is your stress response hormone. It also deals with inflammation, plays a role in metabolism, immune system. So, and then gonadotropins, those are a lot of them being precursors to reproductive hormones, make some level of estrogen, progesterone, testosterone as well. DHEA, which is typically the precursor to reproductive hormones, but plays a role in and of itself. So also, your adrenal glands make adrenaline, which is another name for that is also epinephrine, and noradrenaline or norepinephrine. So those play a huge role in how you respond to stress in your fight or flight syndrome. We'll get back to that. So your HPA axis, beyond just the adrenals, H stands for hypothalamus, P for pituitary gland, and then the A for the adrenal glands. Hypothalamus, part of the brain that controls and oversees your autonomic nervous system, all those things that you don't think about that just happen, your digestion, your heart beating, your breathing, all those really important great things. It also controls your endocrine system and the pituitary gland. And so it wants homeostasis. It wants to achieve a nice balance of everything. And it's always working towards that, regulating sleep, energy levels, emotions, body temperature, hunger and thirst, and more. Your pituitary gland is often called the master gland. It regulates your endocrine system, your thyroid, your reproductive hormones, lots of other different hormones that are occurring. And then those adrenal glands, like we mentioned before, they play a role in regulating blood pressure, electrolyte levels, inflammation levels, immune system, all those good things. So in the conventional medical community, when you talk about adrenal insufficiency, adrenal fatigue, people either are going to think of, like your regular doctor is going to think of Addison's disease, where 90% or more of your adrenal glands no longer work, and you just go on cortisol replacement, and it's a big deal. It is incredibly rare to see that. I worked in an ER for 8 years collectively, and I had one patient who had Addison's disease out of the thousands of people I saw. Really rare. So that being said, it's not the best place to see them. You would see them more in an endocrinologist's office, but anyways, that is less common. So what people talk about nowadays a lot is adrenal fatigue, but it is more accurate to talk about the whole system and how it's not quite working like it should. So your adrenals help you in fight or flight response. Way back when in the day of cavemen and all that sort of thing, your fight or flight response was super fantastic at helping you run away from predators, to either be able to fight what's going on or flight, to run away. These days, we don't face that type of stress on a routine basis, but our HPA axis doesn't always realize that. Our fight or flight response may kick in with sitting in traffic. The kids are hungry and they're yelling. So-and-so may be a little annoyed with that thing they said, or things we don't realize. Ongoing leaky gut, other chronic illnesses. So your fight or flight response, your adrenaline, your noradrenaline are still going when they're not really in a scenario where they're going to save your life. So that has led to this theory of adrenal fatigue, where your adrenals are constantly pumping out cortisol to help you get through all these stressors, and then you pump out so much, and then you've used them all up and they fall off and you have no more. That's the concept that I hear circulate a lot for adrenal fatigue. If you Google medical articles on adrenal fatigue, one of the first ones that will pop up is from MedPage Today that says there's no such thing as adrenal fatigue. But if you look for scholarly articles on HPA Axis dysregulation or dysfunction, you will get over 20,000 articles in PubMed, which is a reputable source for finding medical articles. Yay! Because it's not just this theory that the adrenals are overproducing and then can't do anything. It is the dysregulation or dysfunction of the whole system trying to work things out. It has been compared to insulin resistance and type 2 diabetes, where you're making so much cortisol for such a long period of time that your body no longer recognizes and utilizes the cortisol in the way it's intended or should. Every cell in your body that has a nucleus, which is like every cell, has a receptor site for cortisol. So what happens is it's like during these stressful periods, be them chronic illness or life stressors or all those other things we'll get to, your body gets stuck in the on position for stress. So cortisol keeps pumping out of the adrenals. It's the whole regulation between the hypothalamus talking to the pituitary talking to the adrenals. The hypothalamus should pick up that there's enough cortisol going on, but it no longer recognizes it as well as it should because you're stuck in this stress response. So the adrenals make ongoing cortisol, basal cortisol, like all the time, and then they do spikes when you hit stresses. So you get these frequent spikes of cortisol going on because the hypothalamus says, I still feel the stress, we're still having a rough time. So instead of using cortisol as effectively as we should, we make more than we should, and we don't use what we make as well as we should. That's HPA axis dysregulation, and that's probably what's happening for most of us. So I will still use adrenal fatigue because a lot more people are familiar with that term than HPA axis dysregulation. But anytime you hear adrenal fatigue, please think about the whole system overall. So if you want to see that whole axis of which hormones go where, check out the show notes. I'll detail all of that for you. So a typical cortisol pattern is you have a nice spike in the morning that gets you out of bed, and then you kind of come down gradually throughout the day, and then you go to bed and go to sleep. The cortisol plays a role in your circadian rhythms and your sleep-wake cycle, and having that nice energy and cortisol to get up and out of bed every morning. Unfortunately, what happens for most people, and what my cortisol profile looked like when I had crazy adrenal fatigue, HPA axis dysregulation, is usually you have like nothing in the morning or very like low levels of cortisol when you should be getting up. And then as you get up out of bed and start moving, have a cup of coffee, it'll go up a little bit. And then usually you kind of go back down in the Early to mid-afternoons, you have some caffeine, so it'll come back up, and then it kind of goes back down. And then if you stay up past 10 or 11 o'clock at night, you'll get a second win because your cortisol is going back up. Please go to bed early. Okay, so that's kind of what a lot of cortisol patterns look like in patients that I've seen and when I had HPA axis dysregulation. So what does it feel like to have adrenal fatigue or HPA axis dysregulation? So it is fatigue, a lot of times lack of energy, feeling like you can't keep up with your life or you're having trouble doing your normal daily activities. For men in particular, it's a lack of muscle tone and stamina and being able to do the things you used to be able to do. So it is difficulty getting out of bed in the morning. Your alarm goes off and you're like, oh my goodness. And then you feel a little bit better once you get up, start moving. Movement stimulates the release of cortisol, and have your cup of coffee. If you can't go without coffee in the morning, not just because of caffeine headaches, this can be a sign that your HPA axis is off and needs some TLC. So very common to have that mid-afternoon crash of energy where a lot of people reach for more caffeine or sugar to stimulate something to get them going. And then at night, a lot of people call it being tired and wired. You are going to bed and you cannot fall asleep. That initial falling asleep, you can't turn your brain off. You're exhausted. Your body is tired, but your brain is just going and you have trouble sleeping. Brain fog is not uncommon, that difficulty kind of remembering stuff, concentrating, difficulty losing weight because the whole HPA axis controls metabolism, weight loss, energy levels. Particularly, cortisol has been linked to abdominal adiposity or belly fat, spare tire, muffin top. If your cortisol levels are out of whack, it is incredibly hard to lose weight, particularly around your stomach. So along with that would be weight gain if your adrenals are starting to go out of whack. Salty cravings. Those adrenals control blood pressure and electrolyte balances, and a lot of times salt cravings will help that. Sometimes, although this tends to be more thyroid, but sometimes cravings for sweet stuff happens too because that sugar rush actually soothes the adrenals for a little bit and calms things down. It does a lot of other terrible things. It'll pick you up and drop you off, but sometimes that's the explanation behind why those things are happening. Because these things affect reproductive hormone levels, decreased libido is not uncommon with this. So a lot of people who have this also experience reactive hypoglycemia. You are craving something, you eat some simple sugars, simple carbohydrates, stuff with white sugar, white flour, potato chips, the white potatoes in it, those sort of things, and you will have a little bit of spike in your blood sugar levels and then you'll crash. And that reactive hypoglycemia can happen with the HPA axis dysregulation. Another part of it is as you're having a spike in cortisol, cortisol tells the liver, do gluconeogenesis. That's taking stored energy, fat or usually it's fat, breaking it down into glucose that your muscles and your brain can use right away. And because it's pulling it out of storage and doing that quickly, when you're having a stressful moment, it'll be taken into your cells for energy as needed, and then you'll drop off and you'll have a lower period of blood sugar. So it's incredibly important if you have HPA axis dysregulation to eat small meals frequently with protein throughout the day. So we'll get to the food stuff in a little bit, but reactive hypoglycemia is very, very common. That was one of the big things I had the first time I had adrenal fatigue. So if you get very lightheaded when you stand up too quickly, it's typically a problem with your HPA axis. Terrible PMS can be linked to this as well. Upper back pain, neck pain. Sorry, referring to my notes so I don't get too far off track. Trouble dealing with stress and deadlines and sticking to it, as well as if you feel a ton better when you go on vacation, those can all be signs that your HPA axis is off, that you're just having trouble kind of dealing with things that are going on with that. And moodiness, mild depression or anxiety, those have all been linked to this as well. So what causes it? A lot of different things can do it. For me, it was post-traumatic stress disorder. Some people have traumatic things they lived through in their childhood or adulthood. I spent a year working in a hospital in Haiti. I was there when that big earthquake happened in January 2010. It changed the whole course of the year. It happened after I'd been there 2 months. And there were a lot of very unsafe situations. There were 9 different times where I thought my life was in danger and might end. And that triggered this PTSD experience that I had. And it took me a couple of years to really kind of calm it down, and working on my adrenals helped tremendously. And then the second time I had postpartum depression, which triggered that old PTSD, and I did fantastic counseling that helped a ton. And now I'm finishing up with that background work of getting my adrenals back on track and getting my leaky gut put back together. So Gulf War illness can do it, chronic fatigue syndrome, toxicity exposure, environmental toxins or heavy metal toxicity, alcoholism, stress. Sometimes this is not just bad stress, but big life changes. Did you move? Did you get married? Some big life event like that happened. Had your first kid, or second, or fifth. Every time you have a baby, that's kind of a big life event. So other things that count as stress for your body may be things you don't realize. Leaky gut, thyroid dysfunction or not optimal functioning, your reproductive hormones being off. All those things can add stress to the body and push your adrenals to do not quite like they should. Nutritional deficiencies, chronic illnesses like Lyme, Epstein-Barr, cytomegalovirus, stimulants, caffeine and sugar. Excess intense exercise puts a huge strain on your HPA axis, particularly your adrenal glands. Negative emotions. Do you tend to be a worrier? Do you get stressed very easily? Are you angry easily or more negative? Is the glass half empty? Chronic pain will wear you down and decrease the ability of the HPA axis to regulate itself like it should. Surgery, sleep deprivation, sometimes even just swing shift work or working third shift can do that too. So testing, conventional testing, there's some stuff in the show notes about how we diagnose Addison's disease. What I have found to be more helpful in the integrative world is 4-point saliva testing for cortisol and DHEA levels. So you chew on a cotton swab 4 different times throughout the day, and it'll kind of give you that curve for cortisol levels and let you know where you are, and that can help guide treatment choices and what's best for you. Everlywell does at-home testing. I'll drop you a link. They're fantastic. So you can even try it yourself before you go to the doctor. It's cheaper than what my office charges. So that can be very helpful. So abnormal DHEA levels, both too high or too low, usually leads to a decreased activity of immunocytes that produce secretory IgA. That is your first line of immune defense. That also, when you have low levels of that particular type of IgA, you are at a huge risk for inflammation, inflammatory response, and food sensitivities and allergies. So where it starts, if your leaky gut made you have HPA axis dysregulation, or something like PTSD caused you to have adrenal fatigue, it can lead to food sensitivities and allergies. You can heal it up. Your body's amazing, but there's very often a link between that. So it's not usually just one thing happening in isolation. It may start out as one thing, but very quickly the rest of your body is trying to adapt and help. So it is helpful in most cases for adrenal fatigue to not just do those cortisol levels, but actually to check the wider range of things. Check for leaky gut, look for gluten sensitivity or antibodies, check that thyroid function and thyroid antibodies. Also checking for things like where are your reproductive hormones, how is everything else doing too. Methylation labs can be helpful sometimes too. Some people don't methylate their B vitamins or turn them on and activate them. Some people have a genetic mutation that makes it challenging for them to do those things. So checking if you have that genetic mutation can help too. So treatments, what helps get your HPA axis back on track because it's wanting to do this? So lower your stress levels. Haha, isn't that fun? when I had postpartum depression, it felt like sometimes people would be like, "Oh, have you tried not being depressed?" Oh, thanks. I didn't think of that. That's kind of how I feel telling you this. Like, just don't be stressed. There are things you can do and steps you can take to lower your stress levels. So take a little bit of time and just try to think about what might help to alleviate your stress. I don't mean to make new stresses here, but is there anything you can take off your plate? Anything that is not quite as urgent right now while you're working on these things to help you get better? Quick little things you can do would be meditation. My faith is really important to me, and the Bible talks about meditating on the Word of God. So I'll pick like a Bible verse or two, read it over several times, really think about the meaning, pray over it. The meditation, there's lots of great studies about meditation helping to lower stress levels. Yoga can be very helpful, focusing on your breathing, mindfulness of where you are. Lavender and chamomile are very helpful for kind of promoting relaxation. If you can, I know not everybody has the time for this, but 2 20-minute timeouts during the day have been shown to significantly increase your relaxation levels. I mean, it would, wouldn't it? So do your best, even if you just start with 2 2-minute timeout every day, to just kind of be mindful of where you are, to rest, to practice some of these things. So if you have a history of past trauma or difficulty, something that seems to have started this off, like in my case where it was PTSD, please seek help. Seek a licensed counselor. I did EMDR therapy to reprocess those memories and put them kind of to rest in my mind. It's tremendous, and it can be such a big help for you. And a lot of counselors will meet through Skype, so you don't even have to figure out a babysitter for kids and your schedule for getting there. There are a lot of creative opportunities for you to get the help that you need. And then be sure that you are treating the other things going along with it. Working on your leaky gut, making sure your thyroid's okay, making sure your reproductive hormones are where they are. These things work synergistically to help you feel fantastic, and you will. So make sure that you work on getting a healthy schedule, that you go to bed at the same time every night, and I would highly recommend going to bed before 11 p.m. because if you're awake, there's a natural spike in cortisol that occurs then, making it tougher for you to go to sleep. So do your best. Make time for 7 to 8 hours of sleep every night. Mild to moderate exercise. Be careful not to overdo it with these adrenals while you're healing them up and letting them kind of rest and reset. So there are lots of different vitamins that can be helpful. B vitamins are good because they support energy and metabolism. Just make sure that you methylate them and use them right. A lot of people have done low-carb diets these days. Keto diet in particular has been linked to low B vitamin levels. You're not eating many of the foods that naturally are good in B vitamins. So it's important to focus on that, and we'll talk about healthy carbs in a minute too. So B12, just one of the B vitamins, folate for energy, decrease the inflammation going on, so cortisol doesn't think it has to do it all. Omega-3 fatty acids, curcumin, vitamin C supplementation can all be very helpful for that. Lemon juice can help support the adrenals. Mineral salts, because the adrenals also play that big role in electrolytes and minerals. So that can be helpful. Ribose tea can help to balance cortisol levels. Adaptogenic herbs. There's a whole bunch of different herbs that a lot of different practitioners, naturopaths, integrative medicine people do. My favorite and one that I've had good results in patients with is ashwagandha. It's an adaptogenic, so it turns down those highs and naturally brings up those lows so that you get a more appropriate adrenal curve, so you have good energy for the day when you need it. It's a good idea if you're doing anything else to really talk to a provider, your healthcare provider. Make sure that you're taking the right things for you to feel better. So there's lots of different things though that can be helpful. So diet-wise, there are a lot of things that can make a difference. Do your best to avoid caffeine, sugar and artificial sweeteners, simple carbohydrates, white flour, white rice, white potatoes, white pasta falls into that category. Those things will pick you up and drop you off. So that's not a help in healing this up. Processed foods often fall into that category. Hydrogenated oils, trans fats. I know they're like the dirty word now, so you're probably not doing this anyways, but stay away from them. So be sure when we're looking at things that you should eat to stay well hydrated. Will help to support these things that are going on. That can improve a little bit that postural hypotension you get when you get lightheaded and dizzy when you stand up too quick, as well as taking those good minerals in. Things like the mineral salt that can help to balance those things out. Coconut is fantastic for helping out. Olives and olive oil, very anti-inflammatory. Avocado, bone broth, that's kind of addressing that leaky gut aspect of this, but it's still very helpful. There's lots of good nutrients and electrolytes in there too. Nuts and seeds can be very helpful, decreasing the inflammation. Coconut, I know I already mentioned that, but if you like coconut water, this is a great time to drink it. Coconut water has the electrolyte profile of Gatorade without the sugar, or a few naturally occurring sugars. That's very helpful. Kelp and seaweed and iodinized salts, a little bit of table salt here and there, can help. The iodine comes alongside and supports healthy thyroid function, so it's just one less thing for the HPA axis to stress out about. Cruciferous vegetables, the broccoli, the cauliflower, all that good stuff, but do make sure you steam them first, please, if you've got thyroid stuff. So check out that lecture, which is coming next. And then just want to take a moment and talk about protein and complex carbohydrates. So complex carbohydrates are incredibly helpful for your adrenal glands and your thyroid, but those carbs help to support your body when you're having these weird episodes with the reactive hypoglycemia and the higher levels of epinephrine, norepinephrine, those things going on with the fight or flight syndrome. You want to make sure you have some solid protein along with it, so that otherwise you can still spike your blood sugar levels. The protein will help blunt your glycemic response so you don't get these high spikes, but complex carbohydrates will help your adrenals feel better. It gives you the building blocks to make good, healthy hormones, and it will help with these salty cravings, sometimes sweet cravings that you can get with these adrenal fatigue. Plus, this part's probably my favorite, but complex carbohydrates, when they break down, metabolize into serotonin, your neurotransmitter that helps you feel good. And serotonin eventually breaks down into melatonin, which makes you sleepy. So if you eat simple, refined carbohydrates, the white flour, white sugar, white rice, white potatoes, those sort of things, the white potatoes are refined, but they tend to follow this model. You get a spike in blood sugar levels and then, and serotonin, the sugar high, and then you crash and you get that awful feeling, sleepy, don't feel good. So we don't want that to happen, but we do want you to feel a little better and not feel so stressed about everything. So eat your protein-based complex carbohydrates, things like sweet potatoes, ancient grains like quinoa, lots of other great ones out there, sprouted grains, brown rice. Eat those things together and you'll get some rise in your blood sugar, some serotonin, and then it kind of comes down slowly and you will feel better. So just a thought, I have found those things to be very effective in patients and then personally too. So there you go. There's our adrenal fatigue HPA axis dysfunction chat, and I hope you have a great day. Thanks for joining me. Bye.